To begin, we obtain the appropriate apparel, including a cap, gown, mask, and clean gloves. Our next step will be to perform the hand hygiene process. To begin, we are going to remove any and all jewelry and watches. We're going to adjust our water flow and temperature to our liking and wet the forearms and hands thoroughly. We applied soap liberally to the hands and wrists and washing the hands with strong friction, including the palms, wrists, between the fingers, under the nails, and around the cuticles. You want to make sure to wash for the appropriate length of time, which is a minimum of 15 to 30 seconds, or singing happy birthday twice to yourself. You want to make sure not to come in contact with the sink with any clothing or your body, and make sure not to touch the faucet's sides or bottom of the sink with the hands or fingers. You want to rinse thoroughly from the wrists to the fingertips and then obtain paper towels without contaminating your hands. We dried the hands and wrists thoroughly using a separate towel for each, drying from the wrists to the fingertips. When you go to turn off the water, you want to make sure you use a clean, dry paper towel to turn it off and not contaminating your hands with it. And that is the hand hygiene portion of the isolation procedures. Now we will begin the donning portion of isolation procedures. Some healthcare workers prefer to have an initial set of gloves on prior to putting on their apparel, in case after the removal you have to touch the patient or anything else in the room, but this isn't required. To begin, we want to aseptically apply our gown by first picking it up by the neck. We then place our hands inside the sleeves, working our hands all the way through the cuffs. In most cases, we would first fasten the tie at the neck, but in our case, it is already secured. We then work to close the back of the gown by tying the waist ties, which can be done either in the front or the back, depending on your preference. Next, we aseptically applied our gloves, making sure that they will cover the cuffs of the gowns at the wrists. Next, we want to apply our N95 mask, making sure the bottom strap will go around the neck and the top strap will be at the top of the back of the head. We then squeeze the nose piece, making sure for a tight seal, preventing anything from entering. For extra protection, we place a regular mask over the outside of the N95. We then want to place the cap over our head, covering all of our hair. Now we will enter the doffing portion of isolation procedures. You want to remove your isolation attire prior to leaving the patient room. To start, we begin to remove our gown, pulling from the top of the shoulders. This will break the tie or perforation around the neck for its removal. Keep from touching the outside of the gown by rolling it into a ball. Once at the cuffs, you want to remove your gloves, or in our case, our top set of gloves, turning them inside out and keeping them inside the balled up gown. Now we want to dispose of the gown and gloves appropriately. We are now ready to remove our initial set of gloves to wash our hands prior to removing the rest of our attire, as you will be touching around the facial area. We can now remove our cap and face mask appropriately. We will then perform hand hygiene before leaving the room and again outside of the room. We are now ready to see our next patient.